Hello everyone. Today I am going to introduce Dr. Patricia Benner. Dr. Benner was born May 10, 1955 in Hampton, Virginia. She spent her childhood in California, and it is where she first became interested in nursing when she had the opportunity to work as an admitting clerk at a hospital in Pasadena, California. She received her bachelor's degree in nursing from Pasadena College in 1964, her master's degree in medical surgical nursing from University of California, San Francisco in 1970, her PhD from University of California, Berkeley in 1982. She received Book of the Year Award from AJN, or the American Journal of Nursing, in 1984, 1990, 1996, and 2000. In 1989, she received the Linda Richards Award for Leadership in Education and Excellence in Nursing Research and Education Award in 1990. She was elected an honorary fellow of the Royal College of Nursing. Dr. Benner has published 9 books. Some of them are Educating Nurses, The Primacy of Caring, and her very own From Novice to Expert. Dr. Benner credits Virginia Henderson as the person who greatly influenced her thinking in nursing. She used the Dreyfus model as a foundation of her theory, Novice to Expert, and the concept of reflective practice. The Dreyfus model was first developed to study the performance of chess players. The Dreyfus brothers believe in learning through experience, that learning was situation-based, and that a student had to pass through 5 stages in learning from novice to expert. Dr. Benner found that similar parallels also happened in nursing, where practice depended on experience and knowledge, and developing those skills was a long process that occurred over time. She found when nurses were exposed to various situations, they learned from them and developed skills of involvement from those interactions with patients and family. The nurse gains clinical experience as these abstract principles are expanded over time. To this day, Patricia Benner's model remains one of the most useful frameworks for assessing nurses' needs at different stages of their professional growth. Dr. Benner's theory focuses on how nurses acquired nursing knowledge and not on how to be a nurse. A nurse could gain knowledge and skills knowing how without ever learning the theory knowing that. What novice to expert model has done to the field of nursing is to promote the understanding of what it means to be a nurse. The definition of expert is no longer the nurse with the highest paying job, but the nurse who provides the most qualified nursing care. From novice to expert theory. The first stage is the novice. This would be a nursing student in his or her first year of clinical education. Skills acquisition describes that the person has no background experience of the situation in which he or she is involved. The behavior in the clinical setting is very limited and inflexible, have a very limited ability to predict what might happen in a particular patient's situation, has no professional experience. Tell me what I need to do and I'll do it. The second stage is the advanced beginner. Dr. Benner places most newly graduated nurses at this level. has a sufficient experience to easily understand aspect of the situation, shows acceptable performance, and has gained prior experience in actual nursing situations. Their principles to guide actions begin to formulate. Their principles are based on experience. The clinical situation are viewed as a challenge of their ability and the demand of the situation placed on them. They feel responsible for managing patient care, yet they still rely on the help of those who have more experience. The third stage is competent. This stage is the most essential in clinical learning because the learner must know how to recognize patterns and identify which element of the situation needs most attention. A nurse who have been on the job in the same or similar situations 2 or 3 years develops when the nurse begins to see his or her actions in terms of long-range goals or plans of which he or she is consciously aware. The ability to take action by combining knowledge, skills, values, beliefs, and experience acquired as a nurse. Competent performance considers consistency, predictability, and time management as essential components, develops new rules and reasoning procedures for a plan while applying learned rules for action basis of the relevant facts of the situation. An increased level of efficiency is visible. Display more responsibility for the patient. The fourth stage is the proficient. Proficient nurses perceive the situation as a whole rather than in terms of aspects, and performance is guided by maxims. They can no longer rely on preset goals of organization, and they show an increase of confidence in their knowledge and skills. There is much more involvement with the patient and family. The holistic understanding improves the nurse decision making. It becomes less labored because the nurse now has a perspective on which of the many existing attributes and aspects in the present situation are the important ones. And the fifth stage, the expert. Expert nurses have anticipation skills, insights, use detailed observation, take immediate action, and are able to define priorities. They keep context in mind and have a tendency of specialization. Expert nurses are characterized by their leadership, supervision, and ability to manage change, as well as their communication and relation skills. They have more adaptive skills, confidence, and achieve a broader view. They are competent while managing conflicts and stress, as well as articulating theory and practice. They create knowledge, make use of research, respond to complex situations, and are capable of making decisions. They are no longer aware of feature and rules. His or her performance becomes fluid and flexible and highly proficient.
So, the four meta paradigms in nursing as defined by Patricia Benner. So, first is nursing. Patricia Benner described nursing as an enabling condition of connection and concern, which shows a high level of emotional involvement in the nurse-client relationship. She viewed nursing practice as the care and study of the lived experience of health, illness, and disease and the relationships among these three elements. So next is person. Bonner stated that a self-interpreting being, that is, the person does not come into the world predefined but gets defined in the course of living a life. A person also has an effortless and non-reflective understanding of the self in the world. The person is viewed as a participant in common meaning. Banner believed that there are significant aspects that make up a person. She has so this is the major aspect of understanding that a person must deal as. First, the role of the situation. Second, the role of the body. Third, the role of the personal concerns. And last, the role of the temporality.
Hello everyone. So today I'm going to discuss the 7 domains of nursing practice by Patricia Benner. Okay, the first domain is the helping role domain. In this domain, you serve as a supporter or a guide for your patient. You're providing emotional to informational support for the patients or for her or his family. You're providing comfort measures for the patient. That is in the helping role domain. Next is the teaching coaching function domain. So in this domain, you serve as a teacher or a coach. You are readying the patient for learning, assisting with lifestyles and alterations so that you can match the healthcare needs of the patient about his or her illness and to make his or her illness understandable and approachable. Okay. Next is the diagnostic and patient monitoring function. So in this domain, this is the ongoing assessment and the anticipation of outcomes. So this is the treating process for the patient. Okay. Next is the effective management of rapidly changing situations. So in this domain, you have the ability to contingently match demands with resources and assess and manage care during crisis situations. That is the effective management of rapidly changing situations. Okay, next is administration and monitoring therapeutic interventions and regimens. So this domain it incorporates competencies related to preventing complications during a drug therapy, wound management, and hospitalizations. That is in the administration and monitoring therapeutic interventions and regimens domain. Okay, next, monitoring and ensuring the quality of health care practices domain. It includes competencies concerned with maintenance of safety, continuous quality improvement, collaboration and consultation with physicians, self-evaluation, and management of technology. Okay, and last is the organizational and work role competencies. So in this domain, the last domain, it refers to competencies, priorities in priority setting, team building, coordinating, and providing for continuity of care. So that's it. That's the 7 domains of nursing practice by Patricia Benner.
The acceptance of Dr. Benner's theory by the nursing community. First is the practice. In her book, From Novice to Expert, Benner described clinical nursing practice using an proactive approach. The model has used to aid in the development of clinical ladders of promotion, new graduate orientation programs, and clinical knowledge development seminars. This has greatly contributed in the competency ladders and promotion in the nursing service organization. She has been cited extensively in nursing literature regarding nursing practice concerns and the role of caring in such practice. She continues to publish nursing practice concerns and the role of caring in such practice. In education, Benner's seven domain of nursing practice has the greatest influence and impact on nursing education relative to her works. Nursing educators have realized that learning needs at the early stages of clinical knowledge development are different from those required at later researches. In research, her researches have been used in studying the impact of nursing and its seven domains in early aspects of the profession. Several researches tested these models and validated them. In application of the theory presented by Benner, nurses have a clear vision of the competencies required in order for them to climb up into the leadership ladder.